everyone. Thank you so much for joining this webinar today featuring results from the Global Early Adolescence Study in Chile and Brazil. This is the first webinar where we are featuring these results, so we are very excited to have our speakers here today to share about adverse childhood experiences and how those relate to gender norms, and their context specifically. So I just want to start with a little bit of housekeeping. So we do have interpretation for both Spanish and Portuguese. If you would like to, please do choose whichever language you prefer using the interpretation option at the bottom of your Zoom screen. And you can choose either English, Spanish, or Portuguese. We recommend choosing one channel and not staying in the main room so that you can be sure that you understand everything that is said. We will also be taking questions at the end of our presentations, and we encourage you to please put your questions in the Q&A function. We'll be going through them and moderating that throughout the webinar, and then we'll be flagging specific questions as well that we can hopefully answer at the end. So now I would like to just mention who we have speaking today. From the University of Santiago in Chile, we have Matilde Maddaleno Herrera, and we also have Andres Aedo, who's going to be presenting the results from the GEAS Chile. And then from the University of Sao Paulo in Brazil, we have Cristiane, who goes by Chris Cabral, and Ana Luiza via Borges, who will be supporting with the discussion at the end as well. Just a little background on the Global Early Adolescent Study for those of you who might not have joined one of our webinars before. The GEAS is the largest, most globally representative study examining how gender norms impact the health of young adolescents, which is ages 10 to 14, as they grow up into older adolescence and adulthood. We are in 9 countries across 5 continents, and Chile and Brazil are our 2 sites in South America, and they launched their surveys during the COVID pandemic around 2020 and 2021. And they have been analyzing those results. Chile also has done a second round, but the results that we will be sharing today are from their baseline survey. So without further ado, I will hand it over to Mati, who is going to talk a little bit about GEAS Chile.
Okay, good morning, good afternoon. I am Matilde Maddaleno. I currently serve as the director of the Public Health Department at the University of Santiago and the director of the Global Early Adolescent Study, GEAS. While Chile is classified as an high-income country and have very good health indicators, we continue to confront significant and persistent health inequalities, especially in mental health, that is a priority for this government. In Chile, the GEAS study was implemented by our university in collaboration with Johns Hopkins Bloomberg School of Public Health and the Department of Sexual and Reproductive Health and Research from World Health Organization, which provided the funding for this project. The study was conducted in a low-income suburban region in Santiago, where 36% of the households fall within the lowest income quintile. Additionally, 57% of the parents were part of the economically active population, and 1/3 of the families are single parents households. In total, we interview, after cleaning the data, 688 adolescents, 10 to 14, and their parents or guardians. And among these adolescents in this community, 20% belong to ethnic minority groups, 42 identify as Catholic, and 9% report having an immigrant as a guardian. And concerning adverse childhood experience, ACEs, 15% of adolescents 10 to 14 reported no ACEs, while 30% report 1 to 2 ACEs, 22% report 3 to 4, but 28% report more than 5 ACEs, and with impressive differences by gender. So today we're going to examine what types of adverse effects experience these adolescents and the relation to health outcomes, one of the priority in this country. So we're going to be presenting that. Thank you very much for your time.
Thank you so much, Mati. So now I will invite Andres to share the presentation on adverse childhood experiences in Chile. Andres, I believe you are muted, and if you wouldn't mind putting your presentation in presenter mode,
Ya,
that
ahora
would
sí.
be great. Perfect. Thank you.
Ok. Bueno, buenos días a todos y a todas. Espero que estén muy bien.
Good morning, everyone.
vamos a
I
mostrar
hope everyone's
básicamente
okay.
es,
And
la
basically,
presentación en
I
inglés,
would
pero la
like
vamos a
to,
presentar
the
en
presentation
español.
is
Ustedes
in
me
English,
escuchan
but I
bien.
will present in Spanish.
Es básicamente una primera sesión, ¿no?
This is
sobre
a
el
first
efecto que tienen las ACEs,
session as regards the
el
effect
tipo de
of
ACEs sobre la salud
ACE
mental.
and
¿Ya?
which type we have and
La encuesta
the
GEAS,
effect
esta, o la
upon
primera
mental
encuesta, es una
health.
encuesta multipropósito
This is a
que mide dos escalas
multi-purpose
de salud mental. Eso es
survey
bien
with
importante. No es
two
una encuesta especializada en
segments.
salud mental.
This is
Tiene
not a
muchos ítems
specialized
y muchas
survey
dimensiones.
with
¿Ya?
many items and dimensions.
Lo que nosotros nos comenzó a llamar la atención, ¿no? Es
So
el hecho de
we
que
started,
no
it
solo la
started to call our
acumulación
attention that
de
not
ACEs
just the
tiene
accumulation of
impactos, ¿no? Sí, sobre
ACEs,
la salud
but
mental, que es una
the
cosa
the
conocida, pero
impact
yo
that
creo
it
que bien
has on the
hablada. ¿Ya?
mental health.
Sino que además qué tipo de
And
experiencias
also,
son, porque la
which
encuesta,
type
la
of
encuesta tiene 13
experiences
tipos
we
de
were talking
experiencias, ¿no?
about?
Sí,
Because
pero
we
tienen
have
relaciones
13
entre ellos.
experiences,
¿Sí?
but they are kind of
Entonces, la pregunta de
related
investigación,
among them.
¿sí?
So our
Está
question
asociada
was
a
related
qué tipos de experiencias tienen
to
impacto,
what
¿no?
type of
sobre los
experiences
estados
have
de
the
salud mental
greatest
de
impact
los
on the
adolescentes.
mental health of early
Y
adolescents.
en la medida que fuimos penetrando en los
And
datos, ¿sí?
as long as we started
encontramos que
studying and
hay una
researching, we
forma en que la
found
estructura
that
de
there
ACE
was a way in
en
which
términos
the
estadísticos
ACEs
logra
structure on
mostrar, ¿no?
statistical
Sí,
terms shows
una asociación y un impacto, ¿no?
an,
Sí,
a
sobre la
direct
salud mental.
link
¿Ya?
on an
Nuestra
impact on
hipótesis
mental
DSM,
health.
no es una
Our
hipótesis estadística,
research
lo que nosotros
hypothesis
es que las
uh,
experiencias
has
asociadas
to do with
a
these
relaciones
experiences
sociales negativas, ¿no? Y un
derived
concepto
from
que está
negative
ocupando hoy día,
social
¿no? Sí, tiene un
relationships
fuerte impacto sobre
have an
los
important
estados de salud mental de los
impact
adolescentes.
on the mental health status of early
Los participantes
adolescents.
de nuestra encuesta son 688
Our
adolescentes de 10 y
participants
14
were
años, ¿no? Sí, que compartieron
688,
o que completaron
aged
su
10 to
encuesta sí, en los
14,
colegios.
and they
¿Ya? En general
completed
se
the
hizo esto
interview at
eh,
school.
en salas de clase especialmente habilitadas por parte del liceo.
Schools especially prepared for
Y
this type of
eso
survey.
fue autoaplicado, ¿no? Sí,
And
en
this was a
situaciones a la cual ellos podían
self-applied
contestar cada vez
survey.
voluntariamente,
They were
aunque
able to
autonomamente. ¿Ya?
answer all the points in the survey.
Se ocuparon dentro de la encuesta GEAS los 13
Within this
verificar la
survey,
atención
we
mental, ¿no?
designed 13
Los test
items.
estadísticos usuales son test de media,
We
un análisis
used
exploratorio
media
de análisis
tests, t-test of
factorial,
means,
lineal,
exploratory
lineal.
factor
Hemos
analysis,
hecho
and
más
linear
cosas,
regression
otras cosas
analysis.
y
Those were
están
the
en proceso de
statistical
publicación.
tests
¿Ya?
used.
¿Sí? Lo primero que hicimos fue
The first thing we
estandarizar,
did was to have a standardized
la escala de salud
method
mental en 100
for
puntos para
the
poder
mental
interpretar
health
mejor sus
scale
datos, ¿no?
to be able to have a better
Y
understanding and
y las
interpretation of
experiencias
our
adversas fueron
research.
factorizadas.
And the adverse experiences were factorized.
100 puntos para poder interpretar mejor sus datos, ¿no? Y las experiencias adversas fueron factorizadas. 100 puntos para poder interpretar mejor sus datos, ¿no? Y las experiencias adversas fueron factorizadas. 100 puntos para poder interpretar mejor sus datos, ¿no? Y las experiencias adversas fueron factorizadas. 100 puntos para poder interpretar mejor sus datos, ¿no? Y las experiencias adversas fueron factorizadas. 100 puntos para poder interpretar mejor sus datos, ¿no? Y las experiencias adversas fueron factorizadas. 100 puntos para poder interpretar mejor sus datos, ¿no? Y las experiencias adversas fueron factorizadas. 100 puntos para poder interpretar mejor sus datos, ¿no? Y las experiencias adversas fueron factorizadas. 100 puntos para poder interpretar mejor sus datos, ¿no? Y las experiencias adversas fueron factorizadas. 1 Este es la muestra final, ¿no? Sí,
This is
de
the
control,
final
¿no?
sample
Sí, ahí se puede ver la distribución,
that we
¿no?
had. You
De
can
las edades
see
de
on the
los
screen
jóvenes,
the
¿sí?
distribution among all the
Cosa bien
ages and
importante destacar
the early
cómo,
adolescents.
sí, las
It is
mujeres
important to
entre 13
highlight
13 años
that
fueron
the
altamente
13
participativas, ¿no?
years
Fue el grupo
old,
más
there was
participativo
it
dentro
shows a
de
high
nuestra
level of
encuesta,
participation in this
¿no?
survey.
Y ahora podemos ver, ¿no? Sí,
Now, what we can see
las experiencias adversas, ¿no?
is the
Sí,
adverse childhood experiences
distribuidas tal cual estaban en la encuesta, ¿no? Sí.
distributed. It shows the distribution in the
Aquí está
survey.
reducida el ítem,
This is a
que nombrar,
reduced
aquí está un poco
sample
reducido el
of
porcentaje, ¿no?
items
Sí.
for you to have a better or clear image.
Aquí tenemos los más importantes, son el
We
tema
have the most
agresivo,
important aspects,
insultos de adulto, esta
adult
es la sensación
insults.
de ser irrelevante o carente de
This is an
respeto, ¿no?
association of relevant aspects
La
that we
negligencia de los
considered to
adultos,
be important. Adult neglects,
aquí está el resto, ¿no?
and
Aquí
this is the
está,
rest of the items, as
inseguridad
you can see on the
alimentaria,
screen.
violencia contra la madre,
Violence against the mother,
carencia de protección por depresión de los plenos, ¿sí?
depression of
Padre que no estaba en
guardians,
prisión,
lack of
desalojo, ¿no?
protections,
Y las
evictions,
dos últimas
and the
veces son los
last
ítems
two
asociados, ¿no?
items
A cierto tipo de vulneraciones
had to
sexuales,
do
¿no? Sí,
with
como
some other
eh,
types of
sentir
vulnerable
incomodidad
situations,
cuando un
like
adulto toca
feeling
en las partes
discomfort
más
when being
privadas
touched
y los intentos de
in their
tener
private
relaciones
parts by
sexuales
an adult,
posteriores.
and adult attempts in sexual intercourse.
Sí, es un análisis factorial, ¿no? Sí, para
This
tratar de
is the
agrupar
factorial
ya,
analysis to be able to group all of these
eh,
items together.
las hace, ¿no? Sí, y nos dio esta
You
estructura.
can
¿Ya?
see that this
Sí,
is the
este es un
structure
mapa
that
de
we have.
relaciones
This is
sexuales, está una rotación a la max, ¿no? Sí, para maximizar
factor analysis map,
las assets, y encontramos
and we found
que entre la ACE1 y la ACE5, ¿no? Que
that
son las
between
ACEs que son como
A's
relacionales, ¿no? Que
1
tienen que
and
ver
5, they are like
como
related
adultos
among each
significativos
other, and
que
we can
tienen
see
malas
that the
relaciones, ¿sí?
significant adults had
con los jóvenes,
difficult
se
relationships
agrupan en
with
una sola
the early adolescents, and we can
el sexual
group them as a
discomfort, ¿no? O sea,
subgroup.
la
I'm
disconformidad
talking of
sexual aparece
sexual
como segundo factor y el
discomfort.
último es
It
el entorno
appears as a
disfuncional,
second
¿no? ¿Sí?
important
Ya, esto es
factor.
todo esto está hecho
This
con
is
reglas
also with the
¿cierto?
dysfunctional
Para identificar la
environment.
información y qué tipo
We
de
used a tool, a
software se ocupó.
statistic tool, to have
Al
this
primer factor le llamamos juicio
presentation.
relacional. ¿Ya? Esto
And
según
the
están procesos de
first
interpretación,
factor,
¿no?
relational
Pero
crisis.
básicamente se trata del hecho que son situaciones en las cuales
We are talking about
¿ya? Se generan
situations
interacciones
in
con sus
which
adultos significativos que no están
interactions
basadas en solidaridad,
occur
afecto o
with the
confianza. ¿Ya?
significant adult. And these
El
relationships
segundo
are not
factor es
based on solidarity, affection, or trust.
inconformidad
The
sexual o
second
disconformidad
factor,
sexual, en las cuales las
sexual
interacciones están basadas en
discomfort,
transgresiones
these
sobre el cuerpo, por
interactions
intenciones
are
sexuales.
based on
¿Ya? No
transgressions on
solamente
the
un problema
body with
interaccional,
sexual
hay una
intentions. It's not
transgresión
just
directa. ¿Ya?
a
Y
problem of
el tercer factor,
relationships.
¿ya? Son
And the
assets
third
en las cuales los
factor,
jóvenes son
we are talking
están
about
expuestos a situaciones en las
situations
cuales
where
no
young
necesariamente están
people is exposed
dentro de la interacción directa, ¿no? ¿Sí?
to
Enfrentan
certain
desalojo,
interactions.
¿ya?
I'm talking about
Ser testigos de violencia contra la
evictions
madre,
or
pero ellos no son los que
being
están
witnesses
en el
of
proceso de
violent
interacción.
situations in the process
¿Ya?
of interaction.
Y aquí encontramos una primera estructura de género, ¿no?
And
Que tiene que ver
then
con
we
la
have like a
relacional, que está acá,
first
espero
structure
que
compared by
podamos trabajar
gender.
con más fuerte.
I
Aquí
will
hay diferencias
highlight the
significativas de
situations
género
that
en
show
este elemento
significant
relacional. Las
differences
mujeres
in this
arrastran, como se dice,
relational
¿no? Sí, de nuestra muestra,
element.
mayor cantidad de crisis relacional,
So we
sí,
can see
que
that
los
women
varones.
show
¿Ya?
higher level
Y los
of
otros elementos
relational
no
crisis. And with
tan
the
claramente
rest of the elements, we do not
una diferencia significativa, sin embargo, hay
see
una
a
gran cantidad de casos
significant
anómalos
relation,
que
but we do
estamos
have some
marcando.
anomalous cases in this regard.
Ahora vamos a mostrar, ¿no? Sí,
We will
las
show
escalas, ¿no? Sí, que están presentes en el instrumento,
the
escalas
scales present
instrumentales que están
in the
presentes, ¿no?
instruments,
en el instrumento GEAS, ¿ya?
the Likert scale
Esta es una
for
escala
these
de síntomas
depressive
depresivos basada
symptoms
en
based on
en un test de Likert, ¿no? ¿Sí?
based on a Likert test.
Y quisiera llamar la atención sobre dos
And
ítems
I would like to
súper
call your
importantes,
attention on two
¿ya?
specific
Que es
items.
este,
this one, the one that I am pointing on the screen, the second one, that it says, I blame myself when something doesn't work out, or I feel worried without a reason. I'm talking about young people who, it's the pandemic. Let's remember we're talking about the pandemic time, and the structure keeps changing as long as the symptom is stronger. And I feel bad that I'm thinking about harming myself. We can see on the slide how the numbers represent the level of young adults that had this time of thoughts. You should remember that this scale is built upon the elements that we have, unlike this anxiety scale that shows less amount of positive answers.
En esta se puede ver, ¿no? Sí. ¿Ya? Como algunos síntomas,
What we can see is how some symptoms, like the ones that we can see here, we have some social limits, some days in the last weeks, or I'm afraid that something may happen to me. So what we can see is that these are the symptoms of the last 2 weeks at the time of making this study. And here we can see irritability, which is a very strong feeling, yes, and some problems for relaxing as well. So if we think from a 100-point scale, we see some differences between the genders, which is quite strong. So we can see this significant, and we have like this difference in points from the depression scale and the anxiety scale. If we had the same meter at the beginning of the interview, we could have a higher scale for anxiety, but we are talking about the 2 last weeks. Yeah. So what we did was to work as if these case factors are related in a linear scale with the depression scale. And what we found out is that this ACE, this asset, these experiences, it's related to the depression scale, and it has a huge impact, which is a significant one. And we have to say that this family dysfunctionality and sexual discomfort is very important. And we have here an interval of 30%. As you can see in this chart. So we can say that we may have more experiences that we haven't taken into account. So for example, the food insecurity is not tested. So that would be another meter, is not part of the factors that we evaluated, but we can show now which are the relevances that we gave to this negative relationship that we see. We see this impact over the people. So like this sexual vulnerability is very important to understand here. Here we have the different parameters for evaluating the model, and we can see how we adjust them according to the different meters that we have. And if we think about what is the impact on the anxiety scale, we can see that is a lower scale, but it's still a very significant one. So sexual discomfort is lower, and also the dysfunctionality family. So here we have other graphs of linear effects of factor on anxiety symptoms and how this anxiety comes about, yes, and is shown as a relational crisis, which is for sure one of the most the ones that the most that are affecting adolescents. Here we can see again this model for you to have an idea of how it works. So how is my time going?
You
If you can tell me.
You have about 2 minutes left.
You have 2 minutes left.
Entonces, así, como en términos de conclusiones iniciales, digamos que es una paradoja.
We can think about the different conclusions, yes, as some sort of paradox. There is a disintegration of social bonds, which has an effect on the mental health of adolescents, of early adolescents. And there is a disparity, a gender disparity, which we can see in the different adverse childhood experiences. And of course, we have like this double bond or communication between what the family needs to give, which is protection, yes, and affection and emotional support. And many times children receive insults. So what we can think of is what is going on inside each family internally, but what is also going on in our country, not only in the families. So we have some other topics that I would like to mention. We have an acceleration of the autonomy of adolescents in between the transition from childhood to adolescence, especially in female children, in girls. And this generates conflicts, especially with the previous generation. And these positions of families in Chile, especially if we talk about their status, they are very much linked to uncertainty. So the relationship within the family, they also have this tense bond in relation to how they work to the outside. So all these positions are constantly in tension. The status of the families are part of children's identity. And the problem of self-confidence in Chile, this is not here in the in this screen, but we have a very low self-image in Chile. Yes, so we may have a breakdown as regards these familiar bonds, especially in this relationship between within the family, and this impacts very negatively in the mental health of children, and especially in the way in which the mental health and the identity is something that is very much affected. Adolescents, they do not form their own identity if they are not accepted by the external public. So thank you very much.
Thank you so much, Andres. That was very interesting and striking to see. I will now invite Chris Cabral to present the results from Brazil, and I'll just remind everyone to please do share your questions in the question and answer box, and we will address them in our discussion after both presentations. Okay, take it away, Chris.
Thank you, Kara. Thank you, everyone that is here watching us. And so, hello, everyone. I'm Cristiane Cabral, and this is the work done in Brazil along with two other colleagues, Ana Luiza Vilela Borges, our general coordinator, and Ivan França Jr. The three of us are professors at the University of São Paulo, USP. And we chose the topic of adverse childhood experiences to be sharing here with you in a collective manner. The first data, the baseline that we do in Brazil, in the context of research. This is a work that here in Brazil we were able to obtain financing from our cultural funding agency, FAPESP, to be able to advance this topic. In spite of all the challenges that we faced before, like Kara said, in due to temporarily and due to the pandemic, COVID-19. Just a minute. I think that, can you see the presentation again? Talking a little bit about the context of our research in Brazil. Just to remind you, Brazil, just as like Chile, we are here in South America. Brazil has a continental dimension. We surpassed the quantity of 220 million people. We have a fecundation tax below our contingent of population in the context of reproductive health, as it is expressed by the mortality, mother mortality rate. It's over 62.3 deaths over births. And the more for the suburban areas and impoverished areas, those indicators will get worse drastically. And in this country of continental dimensions, we are situated in São Paulo, this little dot, blue dot in this huge map. And inside that huge map, the city of São Paulo is the biggest Brazilian city with more than 12.3 million people. We performed this research in this map, in the extreme red color in the city of we call like the east area, to try to maintain this the comparison with these other countries in terms of researching the conditions of growth, of transitioning to adulthood of those teenagers from 10 to 14 years old. It's a very impoverished area, the one in which we will be performing this work with little cultural equipment and resources and health, and also in terms of education. It's a very distant area in comparison to the center of the city. That usually has more opportunities to people that will impact, for example, like we will see a little bit further ahead, the dimension of responsibility of those teenagers, adolescents. So the general context in which we perform these studies, and we chose, I don't think it's I think the slide is not moving. Anyway, this is the general overview of the city of São Paulo. And just like the Chile team has presented, the topic of adverse childhood experiences, it's not researched enough in those countries of a low or average income. And studies show that adverse experiences in childhood are sources of stress in young people, such as interpersonal losses that are related to several types of abuse and economic difficulties for sure. And it varies in the trajectory of life as an important factor and influence in life.
With the dimensions, racial dimensions. And there is something else that we're trying to do here in Brazil, is to think about the dimensions of conception and other diverse experiences within the childhood. But to this presentation today, we are definitely going to focus on the adverse childhood experiences, trying to make a comparison among girls and boys. And toward the end, and I want to say where we are going to, what is, and also we want to talk about the our independence, and also GEAS, how it is thought, how it is, this process is done, especially within the youngsters from 10 to 14-year-olds. There was, as it was said before, we had a delay within our countries due to a delay, and only in 2021, on the second semester, when we have actually a decreased number due to COVID, number of deaths. And there were a lot of public schools that were closed. And just within this area, but also looking into the strategies, looking into all the production and about things that we have thought before, and also doing research within these schools, and also closing all the disclosure during the period of 18 months. We have done sort of a survey going door by door, and also with using as a collaborative, as a community agencies. And here in São Paulo, we have a great coverage, especially here for the public health. So we had all the enrollment, what was the perspective, what are their ages, and all the households of that areas. So we went to this, so all that research, all that this was exactly answered by the youngsters from 10 to 14-year-old. So on the next slide, this is just an example. You can see on our left the images of the schools, how it is, the equipment, the devices, the buildings, and this is what you can see in some of the contexts on the right, and this is our images and how we were doing this field trips and surveying the field, and how we were walking through the districts. You can see all there are only houses. You can see that there isn't any building, like a commercial building. And this was basically almost like a rural area 3 years ago. But then they had this residential character, nothing like commercial, as I said before. So with this strategy, we were able to reach 96 surveys, questionnaires answered, and this was exactly well answered. That there is a balance regarding gender. But if you, in this study, to think about the adverse childhood experience, but all these questions that were answered, and the sample that we brought in here, so we had 778 questionnaires answered, and main questions that were answered, and also think about this context and about these girls and boys and their environment and their domestic environment and the neighborhood. And we were talking about these numbers that we're going to be talking. And another detail that I think it is important, and here at GEAS, we in this context of cisgender, we can show that adolescents are not thinking about other genders, just in order to be more specific toward this study. So here in this questionnaire of GEAS, to think about all the or the experience, the adverse childhood experiences, we have analyzed and regarding all the dimensions, how we organized the material into and how we organized, and it was done in 2 dimensions. So one of them showed that there was a positive experience, and then we can gather in a sense of that was a positive experience, and another that was related to negative answers. So these 2 variants, it will show how were their behavior and what was the outcome. So we have done an analysis regarding gender. We have looked into this profile. We have looked into the demographic, social aspect, and we have actually 4 or more history to tell, to share. And there is something very very out there, very explicit. And I would say the declaration that was positive, and this is, I would say that we could recognize that within the adolescents, the teenagers of that age or even older, and majority Blacks, and also Asian, dark, and this is also to show what is the population, not white, and what kind of experiences that they are experiencing. But most of them, and we kind of joke over here that this is a typical Brazilian family, and 92% are within residential that are led by the females. And also it is very important to see that there is that 9 in 10, they said they had at least one adverse experience, and then 4 or more of our participants. There is one data which is not very surprisingly regarding our literature, but looking into this view and how this behavior is affects boys and girls within this dimension. And we have seen that the girls more higher exposure to experiences, to adverse experiences, and also higher in every aspect. They feel to be more isolated than the boys, for instance. And there is the discrepancy is even deeper when there is an exposition of 4 or more of the girls said that they already had, yes, more than 4 cases compared to 30% of the boys. So we are showing here actually this chart, 2 of them split, and those are the items that were composed. But I would like to catch your attention to this chart, and here we can separate what are the items that will make a difference between boys and girls. So the 5 items that will compose their differences, so they are saying always more girls than the boys. So they felt scared, or they were afraid when an adult approached them, saying in a very cursive way, when they didn't feel that they were not protected, and when they saw their parents felt like they couldn't protect them. And we can see that way higher within the girls than the boys. And also they were also saying that they were touched sexually, and they had suffered the sexual harassment, and there is way more vulnerability within the girls than the boys. And how can we interpret that according to all the norms and what it is expected within the gender, and also regarding all these the questions that we had in this questionnaire. And we can think about that the girls are historically more they're encouraged to declare, to say about their feelings. They're encouraged to talk more about their feelings. And also they will also emphasize that, for instance, that masculinity, which is boys don't cry, for instance. We have really to think about in this context that all these data, that boys and girls independently, that they are inserted, and that we are suffering this kind of diversity, and because they are exposed right in their childhood to a diverse experience. And just in order to finish this presentation, we are now dedicated more about other adverse situation experiences, and also how can we build more building and constructing something more independent for girls and boys, and regarding liberty, freedom of moving, freedom to voice their experience, and how they can traverse within that adverse experience, and what is the association. It is important in this school, and also that this freedom circulates within for boys and girls, and how is the dimension and what it is showing, and also having a familial environment safer, and how can we interpret this freedom of circulation within boys and girls for those that have more than 4 adverse experiences in the childhood. And would be a way of finding a safer environment, which is something that they cannot find within their own household. And this happens when regarding to voice and environments with where they are extremely exposed to all of that, and especially regarding the girls. And it's important to start to look at what are the consequences within this way to traverse, and also to finish here. So we have 3 messages here, and there are adolescents very young that they are exposed to all these kind of diverse experiences within the early childhood, but the girls are showing more diversity than the boys. And also we must think about, for instance, that we must advance more in our analysis, and what are the adversities that they are encountering in order to develop their autonomy. And this is for the moment, and I would like to say thank you very much for the opportunities to show
I would like to thank
what
you
are
all
the
for the opportunity
outcomes
to
and the
show
results for
these
Brazil
results
over
of our
here.
research
Thank
in
you very
Brazil. So
much.
thank you very much.
Thank you so much, Chris and Andres, for these presentations. They were so enlightening and really striking to see the prevalence of ACEs in both Brazil and Chile. I would love to start our discussion, and I know Mati and Anna are going to be joining us for that discussion as well. So first off, I just want to ask a general reaction question to both Brazil and Chile. Maybe I'll let Chile go first, just understanding your results and then seeing the results from Brazil. I'm curious, what you thought. What are some similarities, some differences? What are some reflections that you have? So I'll start with maybe Mati and then go to Anna for that.
Bueno, yo pienso que claramente en prevalencia, ¿no es cierto? Brasil tiene casi 10 puntos más en ACEs que en Chile, ¿no es cierto? Pero lo que es muy impresionante es que en los dos países hay diferencias por género, o sea, claramente las mujeres están más expuestas, ¿no es cierto?, a las experiencias adversas de la infancia. Yo creo que también algunos
The
resultados tienen que ver
differences,
con los determinantes
and
sociales,
this
¿no
has
es
to
cierto?,
do with the
de las zonas
social
empobrecidas de Brasil,
problems
donde el
that we have.
90% de
We
los
have a
hogares
90%
son
of
familias
the
monoparentales
homes
dirigidas por mujeres,
with
un 30%
monoparental
en Chile.
families
Para
who are
saber un
women are the
indicador
head
de la
of the
diferencia
families. So this is a huge
los determinantes
indicator
sociales. Yo creo
between
que habla
the
un
countries
espacio
in
muy
these
importante para
social
poder
spaces,
trabajar
in the
en el
social
futuro
context.
en
So we
protección
can work
social con
quite a
los niños.
lot with social protection for these children in these two
Olá, então,
countries.
bom dia, boa tarde, boa noite aqui. Obrigada, cara. Obrigada, Mati.
Uh,
Primeiro, parabenizo a
Good night, good
equipe
evening,
GEAS
everyone.
Chile
First of
por
all,
essa
I'd like to thank
apresentação
the
brilhante, os
team in
resultados
Chile for
extremamente
this
interessantes. Eu
brilliant
acho que vem
presentation. The results are
realmente com um
very
bom
interesting,
portfólio
and
de
they come with
estudos
a
sobre os
portfolio of
adolescentes mais
studies
jovens aqui na
about
América Latina, que é da maior
earlier
importância.
adolescents in
Eu
Latin
vejo os
America, which is
nossos
very important. I
resultados
see our
muito
results
similares e uma
that are very
triste
similar,
coincidência,
and it's
né?
a sad
Altas
coincidence.
proporções de experiências
High
adversas que são
proportions of
relatadas por
adverse
meninos e
experiences being
meninas nos
reported
dois
by boys and
países.
girls in both
As
countries.
diferenças de gênero são
The
marcantes, as
gender
meninas,
differences
em geral,
are
muito mais
notable.
vulneráveis
Girls are
a
way more
relatar ou a
vulnerable
vivenciar, sentir essas
to
experiências
report and to
adversas, o que
experience
mostra
and to
também
feel
que nós
those
temos
adverse
muitos
experiences, which
desafios aí
shows
na
that we have a lot of
socialização e também
challenges
na
in the
proteção a essas
socialization and
meninas.
protection of those
E
girls.
o que a literatura tem mostrado, mas
And
que
what
nós
studies
também
have
confirmamos
shown, and
aqui
literature has
nos
shown,
dois
and that we have
países, é
also
que essas
confirmed in both
experiências
countries, is that
adversas
these adverse
têm sim
experiences,
efeitos negativos ou
they
estão
have negative
relacionados aos efeitos
experiences, of course, and
negativos
they are
na
related to negative
saúde dos adolescentes, tanto em
effects, of
termos de
course,
saúde
in their
mental, que foi
health
o
of the
que
adolescents,
os dados
both
do
in
Chile
mental health,
mostram, quanto
which
nas questões
Chile's
da
data
agência
shows,
individual, no
but
caso dos
also
dados do
the
Brasil, e
agency, individual
apontam
agency
já
in the
que
cases in
pode
Brazil.
parecer bastante
They
positivo
show
que os
that it may
adolescentes
be
que
very
reportam
positive that
mais
adolescents that report
experiências adversas têm a
more
maior
adverse experiences,
autonomia
they have more
de deslocamento,
autonomy
mas isso pode ser
to
justamente algo que
to
nos mostra que eles estão
dislocate or to
querendo
move
se
around, but
distanciar
that
da
shows that they are
casa, né?
trying to
E após
distance
também
themselves
a
from their
dimensão
homes,
voz, o
and the
poder, né, de se
dimension of their
pronunciar,
voice, the
de
power
mostrar
to
aquilo que
speak up
pensa,
and to
também
show
foi
what they
afetado
think
ou
was
está
also
negativamente
affected,
associado
was
aos,
negatively associated
às experiências adversas.
to the
Então, eu
adverse
acho que são
experiences.
tristes
So I
coincidências que nós
think that
temos,
these
mas
are
isso
sad
mostra vários
coincidences,
desafios e
but
vários
that
caminhos
tell
que nós
us
podemos seguir a partir desses
several
dados.
challenges and paths that we can pursue after that data.
Yeah, thank you, Anna. You're right. It's very interesting, the results that you had on agency and those different freedoms, and I appreciate that interpretation. I think that's really important to have that that explanation, because it can be a little counterintuitive to think, they have more freedom, but also more adverse experiences and the complex relationship with that. I also want to dig a little bit deeper into the differences that we saw between boys and girls. We saw this in both sites. Brazil, we saw, girls having a lot higher exposure to ACEs. And then in Chile, we had strong differences between boys and girls in the mental health outcomes. So maybe I'll go back to Brazil quickly to talk about, some of the reasons you might see behind those differences in those ACE exposures for girls and boys. And then I'll go to Chile to talk about the differences in some of those mental health consequences.
Thank you, Cara, for the question. It really is very special to us it's very difficult for us to think about this context of socialization of boys and girls. Girls are spending more time inside their houses, their homes, subordinated to certain contexts. And the dimensions of the questionnaire, as far as like these experiences in Chala, talks a lot about those house experiences, those home experiences. So it reports, it reflects this socialization of gender that is very strong, that is very predominant, that we see here in the Brazilian context. I think that this is one of the first layers for us to talk about that differentiation between boys and girls, for sure. The second layer, I think that we need to think actually about what we are able to capture with our strategies in terms of methodology with this type of questionnaire, because at the same time, we know that there is a certain strong pressure, like I said, for boys to contain their emotional expression, and girls don't have that type of pressure. So we see that disparity in terms of experiences in childhood. Of course, you have the dimension of the context, but we're also asking ourselves about what was possible to determine in terms of gender norms and expectations, what we are able to truly determine in this type of research with that kind of methodological dimension. So those two interpretative layers, they make sense when they are put together.
Thank you so much, Chris. I think that makes a lot of sense. Mati or Andres, would you like to talk a bit about the gender differences you saw in those mental health outcomes?
Sí, hola.
Yes, hello.
Sí, bueno, el problema con
Well, the problem
al preguntar los síntomas, ¿no?
when
Sí,
we
en
think
las
about the
pruebas, ¿no? de salud
symptoms
mental,
of this test, of
es
this mental
posible,
health test,
que
we can
ciertas percepciones y
think
ciertos
of certain
elementos de la identidad masculina
perceptions and
oculten,
elements
¿no?
of
Sí,
the male
algún tipo de
identity
expresión o
that
algún tipo de
are not
síntoma, ¿no?
showing some
Em,
symptoms, yes, or some
¿ya?
expressions. They are not expressing
ese
everything.
como error,
In,
como
but
no muestral, digamos, es bien
but
difícil
this
de
is just
detectar o no,
a
digamos, ¿no? En
sample,
términos de,
and so
porque
it's
es muy
very
preciso
difficult
el
to
síntoma. En tal
detect.
sentido,
It's
esto,
very
¿no? Por
precise
tanto,
to
no sé si
find
es el hecho
sense.
de que las mujeres
So I
expresan
don't
más o
know
menos,
if
digamos,
it
lo que
is
tienen que expresar
related
por
to
lo que
how
se
much
siente, digamos.
women
Es
express,
posible que el
uh,
bloqueo de la
but
masculinidad
how
lo
they
haga,
feel.
digamos, pero
So
habría que
probably we have
indagar
a
un poco más
blockage
profundamente en
of
eso, digamos, ¿ya?
masculine
Lo que sí me
identity, but
gustaría
I don't know if
destacar
it is
que,
related with
es
that.
el tema
With
de la
that.
autonomía y la
So what we
movilidad que
see is
está, como
autonomy
indican
and mobility,
en la encuesta, ¿no? Sí,
which is
que nosotros
also
los tomamos, ¿no?
reflected
Sí,
in
también
the
como informe de
survey.
la agencia para
And
poder
what we see
cruzarlo con temas
here
de salud
is
mental, con la
that we
esperanza
can
de que, por
cross
ejemplo,
that
pudiera bajar los
with
niveles de ansiedad.
mental health.
Sin embargo, no salió positivo
So
respecto al
what we
nivel de
try to do
depresión,
is
¿ya? Y
to
esto desde mi experiencia
low
inicial de
down the
investigación sobre como
anxiety
las relaciones
symptoms.
cortadas, digamos, las relaciones en las
And
que
we
los
have
niños que
to think
vivieron o que
about
tuvieron
these
mucha autonomía durante el
negative
proceso de pandemia y
relationships,
post-pandemia, ¿no?
especially
Sí, la
children who
entendemos como una
had
situación en la
very
cual
difficult
el
processes
vínculo
during the
social que tienen con sus
pandemics.
familias está
So
cortado
we can think
desde este
about
punto de vista,
this
¿ya?
family
Y las
bond
ACEs que muestra
as
Brasil, que
something
tienen
that is
gran diferencia
broken,
de
as a
género,
bond that
por
is
ejemplo,
broken.
están asociadas a
And
este factor inicial de
the
crisis
difference
relacional,
between
¿ya? Eso de los
gender
post 5
is
primeros ítems,
related to
que son los que
this
corresponden con nuestro buen
relational
factor.
um,
Entonces, lo que estamos
factor
viendo, ¿no? Que hay
that
una
is
crisis,
related
¿no? Sí,
to
relacional
ourselves.
entre
So we
mujeres
see
y
the
sus
relational
como
crisis
familia, que es mucho más
within
marcada
the
que la que
family,
podrían tener los
which is
varones con su familia, dado que
very
los varones parece
much
que son,
present in the women,
tienen una
because
autonomía mucho más rápida,
male
¿ya? boys,
they have autonomy, they got autonomy much more easily, and women keep attached to the families for long. Sorry, I couldn't listen to him very well. So we have this conflict with the women have more conflicts with their take cares, and this could this social bond is like stretching, yes, as if it was like a chewing gum, that it's never broken. That is the situation with girls. So these differences between gender appeared very significantly. But the effect that they have, this rational effect that they have over this sentimental state, it has been a huge part of the investigation, and we are still collecting evidence and making it part of our report. Well, that's it.
Thank you
That's
so much.
the approximation I can make.
Thank you so much. And that started to actually get into my, I'm going to call it my last question because it's kind of a big question, and I'll address it to both of you. But you know, we have a few questions in the chat that kind of talk about how do we address this, right? We see these really big challenges. We see different ways that boys and girls experience them. We also, there's a question in the chat about the different help-seeking behaviors for boys and girls, you know, after they might experience some of these events. But, you know, I guess the question is what policies and programs, how is this data going to influence those policies, programs, or, you know, future research that we can do to potentially break this cycle of adverse experiences? So maybe I'll start with Mati, if you wouldn't mind addressing that question, and then I'll bring it back to Brazil.
Sí, yo puedo contestar esa
Okay,
pregunta.
I can answer
Bueno,
to
a mí
this
me parece que hay
question.
dos
I
dimensiones. Una
think that there are
dimensión
two
local, que
dimensions.
tiene que
One
ver
is a local
cómo, ¿no es
dimension,
cierto?, vamos a devolver estos
which
datos que se
is
los
how we
estamos
are going
devolviendo a
to
las escuelas y a las
return
comunidades que trabajamos,
the
¿no es cierto?
community and the
Y
school
juntos, de
with all
forma
this data,
colaborativa, poder
and
hacer
how,
un
in a
plan de
collaborative way,
intervenciones, ¿no es
we
cierto?, que nos
can make a
permita
plan of intervention
disminuir estas
that
áreas
allow us
o
to
en forma intersectorial
download
poner un
these
programa
problems,
que
yes,
permita
or
mejorar la
make
salud
some
mental usando
program
promoción y
to
prevención como
improve
gran
the
elemento.
mental
Desde el punto de
health
vista político,
with some
nosotros vamos a presentar
interventions.
estos
And
datos
from political
en el
point of view,
Ministerio
we
de
are going
Sociales y en el
to
Ministerio de
show this
Salud, ¿no es
data
cierto?
to the Health
Claramente
and
buscando
Social Ministry.
reforzar
And
algunas
we
políticas
are
que son
trying to
importantes, como,
reinforce some
¿no es
policies
cierto?,
that are very
reforzar el Chile
important,
Piense
like,
Contigo, una
for
gran política
example,
intersectorial chilena que tiene que
Chile
ver que
Pes
todos los niños
Contigo,
tengan
which is a
acceso a
policy for children to
programas
have
de
access to
desarrollo temprano.
to
Nosotros
the
claramente eso tenemos que
policies
mejorar
of
la
early
participación
development.
social
That is
de los
something
niños, ¿no
that
es cierto?,
should
y
be
los
improved.
programas tienen que
Also,
empezar a
the
usar
social
este enfoque de
protection.
curso de
And
vida,
these
porque no podemos pensar que
programs should
solamente vamos a
start
intervenir
working
en la
with this
adolescencia, ¿no es
data
cierto?,
and
y no es nuestro
intervening
problema
even
lo que
before
pase antes.
adolescence.
Entonces yo creo que
So
los
we
tres
want to
componentes
focus
nosotros nos
on
vamos a
early
articular para llevar
adolescence,
estos
and we want to
resultados
make
a
an
nivel
intersection
político y
with
hacer
the
abogacía
government, with
para
the
que esto, ¿no es
police,
cierto?, se
with
entregue a las
the
escuelas y a las
politicians,
comunidades en las
for
cuales
this to be
trabajamos.
taken into account in the communities and in the schools where we work.
Eu queria completar algumas coisas em relação ao que a Mati disse, né? Então, assim, acho
I'd
que em
like
termos
to complement some things that Mati said. I
ações que
think
a
that
gente
there are
fez
certain
na
actions that
região que a gente trabalhou,
we
fez a pesquisa,
took in
fizemos
the area
ações
in
junto às
which we
escolas, né?
researched, and some
Junto ao
actions
serviço
that
de
we
saúde, mas
performed
de um
together
modo
with the
mais
schools and the
amplo, né? Que a
Department of
gente
Health.
vem
But in a
utilizando
broader
esses dados, né?
context,
Que a
we have been
gente
utilizing the
encontra,
data.
é pensar realmente a
Um,
importância, né, de
it's important to think
serviços,
about the
de uma
importance of
educação, de um
services
sistema de
and
educação
of a
bem mais
system of
preparado
education
e bem
that is
mais
more
acolhedor,
prepared
né?
and
Para poder,
more
seja para poder
welcoming
receber
to receive those dimensions, to realize those experiences that are adverse, and to understand the dimension that truly affect boys and girls, and to understand that that's not a dimension only of the family or
To
individual.
realize that this is not something just familial, but this is a social. So we need something that's going to be macro, that will provide the right support, especially for impoverished areas. And also through this system, the educational system, that must be way more prepared to understand all the complexity of this process of the development within boys and girls. And I would say this involvement of the education of the families, I think we have to fight more over, especially within with the public policies. So we have a better intervention in that direction.
Thank you so much to Chris, Anna, Andres, and Mati for your presentations, for sharing this really insightful data. We love seeing the results from both of your countries finally coming to a global stage, and we hope to do a lot more of that. I thank all the participants for joining today. We will be sharing all of the presentations and recordings after this webinar with all of the participants, and also links to reports and papers that have come out of both of these sites. So we thank you so much for joining us today. Thank you again to our presenters, and we look forward to seeing you at another GEAS event.